Hello, and thank you so much for the introduction. It's an honor to moderate this panel. It's such an important panel today. And on a personal note, this panel is especially meaningful to me as my sibling, my sister with CF also battled with intestinal cancer. And as Dr. Moss so eloquently and comprehensively shared, hopefully you all saw it, during his excellent presentation, adults with CF are living longer. And so additional health complications are emerging. And some of these are related to having CF, and others are made more complex by our CF diagnosis. Our panelists will share insights and perspectives on detection and treatment, as well as the mental health implications of this dual diagnosis. So there are conflicting study results examining breast cancer risk among women with CF, but one found that those with CF had over 3 times the incidence of cancer as the general population. Researchers found evidence of the role of sex hormones, particularly estrogens, as we heard previously, impacting the pathophysiology and immunology of CF. Colleen will share her personal story facing a breast cancer diagnosis, and there's Colleen up there. There's a higher risk, let me go to the next one. Okay, there's a higher risk of pancreatic cancer among those with CF. A 2024 study found statistically higher rates of pancreatic cancer among the CF community than the general population. And this study also found that pancreatic cancer diagnosis was more likely among CF patients with a history of pancreatitis. On its website, UCLA notes that those with CF have up to 6 times the risk of pancreatic cancer as the general population. And we'll soon hear from Christine, who will share her brother's cancer journey. While rates of skin cancer are not believed to be higher than those of the general population for people with CF pre-transplant, this changes radically post-transplant. Due to the immunosuppressants required to ward off rejection, the projected risk of some form of skin cancer is up to 100 times greater than the general population. And the most common skin cancer diagnoses are for squamous cell carcinoma and Kaposi sarcoma, but also basal cell and melanoma. And we're grateful, hopefully Elyse will be here for sharing her story. We will make her words known either way. And she has also prepared some tips for skin cancer prevention. And there's increased awareness of the higher risk of certain cancers for adults with CF, most notably gastrointestinal cancers. People with CF are 5 to 10 times more likely to develop colon cancer. And for those with CF who've received a lung transplant, the risk increases to 25 to 30 times that of the general population. Receiving a colon cancer diagnosis can be challenging. First, colon cancer symptoms often mimic CF-related GI symptoms like bloating, constipation, flatulence, et cetera. And so it's easy to ignore them until the cancer has advanced. It's also challenging for younger people, as currently the CF recommended age for people with CF to have their colonoscopy is 40, which organizationally CFRI disagrees, but it's another story. So it's also important to note that CF carriers are also much more likely to develop colon cancer, with rates twice of those of the general population. And today we'll hear from Thomas, who shares his experience battling this cancer. So with that, I'll turn it over to the panelists, and we'll start with Colleen Lewis. Colleen is from Philadelphia, Pennsylvania. She's an adult with CF and a breast cancer survivor. She owns and operates a thriving dog boarding business in Philadelphia, as well as teaching yoga classes for the CF community. So let's welcome Colleen.
Hi, everybody. Thank you for that intro. Kind of says a lot of what I was about to say. I have some slides with some photos on them. So I'm just going to say next slide when I'd like to advance. So This is a photo of me in a yoga pose with Philadelphia behind me. And I was going to say, I'm Colleen. I live in Philadelphia and I teach yoga. Jeannie already said that. Next slide. And then this is me when I had hair. This is the photo that is on my doggy boarding website. But hi, everybody. I'm Colleen. I'm 38. I have cystic fibrosis, and I've also survived breast cancer. I live in Philadelphia and receive care for all of my conditions and organs at the University of Pennsylvania. You may have met me before as your teacher. I apologize. I am working right now. There are dogs in my house. I have one who I thought was going to be the problem child in the kitchen, but my own problem child just barked at him. I'm sorry if the dogs chime in. I was going to say, you may have met me before as a yoga teacher. I've taught for CFRI's wellness programs, for Breathe Strong CF, which used to be the CF Lifestyle Foundation, and for CF Yogi, which is now supported by the Boomer Esiason Foundation. I am so grateful that so many great patient-focused CF organizations exist. I'm also a small business owner. I run a private doggy boarding house, which is probably going to give us some sound difficulties. I'm going to separate my one and B. So now to get into my breast cancer story, I want to share that my first time having a lump and mammogram scare was in 2016. I had been living in Scottsdale, Arizona at the time, and I'd felt a lump in the side of my left breast. So I made an appointment with my OB and they scheduled me a mammogram. At the time, it had only been a year since my mother's first battle with breast cancer, so I was really scared. I actually had a panic attack while they were doing the scan, and the team was super nice to me. They let me lay down in the biopsy room, which is the picture you see there of me being emo. And they had a doctor come in to read my scan results as quickly as they could, like same day, which is rare. So that I'd be a little calmer before I left. It was then that I learned how duct tissue can fluctuate in size over the course of a menstrual cycle. That's the sort of flower-shaped tissue that you see on female anatomy models. Anyway, that is why breast cancer awareness advocates are so big on the Feel It on the First campaign, because if people who menstruate always feel their breasts at the same time of the month, in most cases, it will be the same phase of their cycles. So if there's anything I would like you to remember from my little spiel about cancer, it's that please feel it on the first. Next slide. So fast forward to 2023. I was noticing a lump on the side of my left breast again, in the same exact place that I thought I had felt something in 2016. I mentioned it to my OB here in Philadelphia, where I was living and I'm currently living. And she felt it in April, and gave me a scheduling number to call to schedule a mammogram within the Jefferson Health System. And she told me that because my lump was smooth and movable, that she wasn't very concerned about it being cancer, because cancer bumps aren't usually smooth and they don't usually move. I do believe that was her professional opinion, but she was wrong. It took until September to be seen for that mammogram. And the day I went in for that, they actually held me at the center, made me get a biopsy same day, and I was diagnosed with breast cancer by a doctor, like some random person who was on hand that day. And then over the next few weeks, I did a bunch of scans to see if it was spreading because they had found it in my breast tissue and 2 lymph nodes. So we knew it was invasive. At that point, I transferred into the Penn system because that is where my CF doctors are. And I just wanted all of my doctors to have the easiest communication possible so that if during the course of my care, anyone needed to be contacted, it would be like through the same MyChart system rather than going from hospital system to hospital system. I got a port, which was my second, placed really quickly. Got started with a cardiologist because of a potential interaction between Trikafta and the specific chemo drugs that I was about to be put on. Had my head shaved and donated my hair, which is what you see in that third picture. And I got myself a wig, which you also see in that third picture. Next slide. Because my cancer was invasive, chemo had to come before surgery. I kept my business open for 2 weeks into receiving chemo treatment, thinking that it would be kind of like being on IV meds for CF and working through that, which I had done many times in the past. But I ended up closing from October until May of this year because my energy levels just plummeted. My breast cancer was ER/PR, estrogen, progesterone positive, and HER2 negative. So my specific chemo regimen was called the ACT regimen. The first 8 weeks were the AC treatments, which is that red medication you see in the photo. People nickname that the Red Devil because that is the drug that makes all of the chemo side effects start, including the hair loss, which I had my head buzzed, but in the course of doing that chemo, it all fell out. There was I eventually lost my nose hairs, my eyebrows, and my eyelashes, which meant that I was runny nosed and teary eyed a lot. My eyes were always red and kind of sunken because I was so tired. And then the last part of chemo was 12 weeks of the T portion, which is Taxol. And that caused me to develop some neuropathy in my feet and fingers. But that is healing now because I am a few months out from that. Next slide. This is just some more photos from during chemo. One of my doggy clients is actually a HUPS pup. HUP stands for Hospital of the University of Pennsylvania. And so he and his mom came to see me during one of my chemo treatments, and it made me really happy. When you work with dogs, you get a lot of oxytocin on the daily. And so being close for business was really extra depressing. And it was great to see him and his mom. I rang the bell or finished chemo in March of this year. I had my lumpectomy surgery in April, which meant I could officially call myself cancer-free. And then I started undergoing radiation treatments in May. Next slide. I did 3 weeks of photon radiation, which gave me terrible burns that are still healing. And I finished that and rang another bell in June. I actually took this picture of my armpit because the burn had sort of chafed or peeled away in the shape of a heart. And I was going to send it to Summer. Many of you probably know her. She finds hearts in like random places and takes pictures and shares them. So hi, Summer, if you're watching this, I was breathing out love. Next slide. This is just sort of a palate cleanser photo to get the armpit off the screen. So I am back to work now, surrounded by cute, loving little creatures every day. I am on hormone suppression medications to keep my cancer from coming back. So I am in medically induced menopause. I am currently navigating cardiac care, figuring out how to be on blood pressure medication without feeling faint. Um, I'm also currently losing weight without trying, which is like the opposite of what you would expect a woman on Trikafta and recently put into menopause to do. So I'm thinking I have to start looping my endocrinologist into my life again, which is something that Trikafta sort of enabled me to stop doing. Um, but I've heard a lot of people say that cancer is a chronic illness, and I wholeheartedly agree because the care necessary to keep it from coming back is like its own chronic illness. The cancer is gone, but the care for it remains, and I will likely be tending to these issues for the rest of my life. Yeah. So that is my cancer story. Um, I think that having CF prepared me for a lot of it, but it was very hard. And I think that during the questions that are going to be asked later, we will talk a little more about how I coped and the things that helped me through it. Yeah, I will mute myself and the dogs and invite the next panel.
Thank you for sharing your journey with us. We'll move to the next panelist, and then hopefully you all will have questions at the end. Next, we'll hear from Christine Nash. Christine is a strategic advisor and board member of the biopharma industry, focused on helping to bring new medications to market for the treatment of rare diseases. Christine had two siblings with CF, Elizabeth and Patrick. And in 2004, Nash family members co-founded the Elizabeth Nash Foundation in honor of Christine's sister, Liz, who died at age 32. Welcome, Christine.
Thanks, Jeannie, and thank you very much to Siri for inviting me here to talk about my brother, Pat. In many ways, my brother Pat's life was an incredible success story, especially for someone born with CF in 1967. He was a three-sport athlete. He earned undergraduate and graduate degrees, got married, had a full-time corporate job, and at the age of 36, he welcomed his beloved twins. It of course, wasn't always easy for Pat. As he reached his mid-30s, managing his CF required a lot more time and effort, and the fight got harder. He was hospitalized a number of times for exacerbations. He battled mycobacterium for 13 months. And he incurred vestibular damage from autotoxicity. Medical innovation, first Orkambi and then Trikafta, seemed to arrive just in time. And as Pat approached the age of 55, his FEV1 measured a remarkable 95% of predicted value. In February 2021, on a trip to Key West, my brother's wife noticed yellow in his eyes and on his belly. Their CF specialist advised them to go straight to the local ER, and then back home to Boston, where Pat was immediately admitted, and a few days later diagnosed with stage 2A pancreatic cancer. Fortunately, Pat's cancer was deemed resectable, but unfortunately, despite responding well to chemo and having a successful Whipple surgery to remove his cancerous mass, in September of 2021, we learned that his cancer had returned and aggressively spread to his liver. He passed away 2 months later. Now, a lot of you may be wondering, why the heck did Siri invite her to talk today? This is a difficult story to hear, but there are some really important takeaways from Pat's life and from his cancer journey. And what I'm here to share with you today is the advice I think he would give to people fighting cancer and CF if he were here to deliver it. So here we go. This is just a few pictures of my brother and his family during his battle. So what would Pat share with you? First, keep moving. Throughout his life, Pat treated exercise as an integral and mandatory part of his care plan, and he pursued it with great vigor. It helped him maintain his physical and mental health. It gave him challenge and identity beyond just being a person with CF. And very importantly, it gave him fitness and strength that he needed to endure his chemotherapy regimen and to qualify for his Whipple procedure. Number two, know your own body. There are really two aspects to this. First, pay attention when things don't feel right, even if you can't put your finger on the why. Only you know what's normal for you and when it might be time to raise an alarm bell. Second, use data when you can. Pat had a spirometer at home to track his lung function. He knew how compliant he was with his meds, and he had metrics from his exercise. Now, he didn't track these every day, and he didn't obsess about them, but knowing how he felt and what the data said helped him assess where he was at and helped him provide a more complete picture of his overall health to his care team. Number three, invest in your relationships with your care team when times are good. I could really talk about this all afternoon, but let me just highlight three things here. First, if you're faced with a medical crisis, especially if you're not near a major academic center, a trusted healthcare provider can make all the difference. Pat's CF Center pulmonologists helped guide the diagnostic process with the Key West ER, and then facilitated expedited testing, necessary procedures, and diagnosis when Pat returned home to Boston. He and Pat's gastroenterologist specialist remain close allies and invaluable advocates throughout Pat's cancer journey and his end of life. Second, there is still a ton to learn about treating CF and cancer, and you might be the first CF patient your oncologist has ever treated. Creating a strong direct connection between your CF and your cancer teams can facilitate better care and alleviate management and communication burden on you. Identify a core team, and importantly, be selfish and directive. Time and energy, as Colleen has talked about, are precious resources in a cancer fight. Here's how I'm pretty sure Pat would advise you to manage the people in your life. First, find a small group of trusted people who can help you. Put them to work in whatever way is most helpful for you, doing research, running errands, arranging meals, or maybe communicating on your behalf with family and friends. Second, recognize that most of the people in your life are well-intentioned, but not very helpful. He was a very straightforward and candid guy, my brother, for those of you who knew him. Afford these people some grace when their absence makes you feel lonely and isolated. They may well be pulling back because they don't want to bother you or they don't know what to say or do. And finally, don't spend any time on people who drain you. It sounds cold, but you need every ounce of energy to deal with the real problem. Next, keep your house in order on an ongoing basis. Wills, beneficiary structures of accounts, passwords. These are not what you want to be dealing with if things suddenly go sideways. Unresolved relationship issues are not either. So make things right on an ongoing basis. Next, and this one is pretty tactical, but was really quite important for Pat and for our family. Audio record your medical appointments or phone in a friend. With a cancer diagnosis, there is a tremendous amount of new information to absorb and a lot of emotion to process. Knowing you have a recording or another human to rely on can reduce stress and both improve and speed up your decision-making. Finally, advocate for better research and surveillance. One of the few phone calls that I vividly remember having with my brother occurred about 4 months before his diagnosis. Pat told me that given his lung function and overall health, he was pretty confident his core CF wouldn't be what got him in the end. He was hearing more about the many complications being faced by his adult peers, especially cancer. He talked about how the community had to figure out what was going on, what to surveil and how to surveil in a way that was reasonable, given the already overfilled plates of his fellow CF adults. Pat didn't get a chance to continue his work on these important challenges. My hope is that others will, so that we can continue to move closer to reaping the full benefits of the amazing recent innovations in the development of CF-specific therapies. Thanks.
Thank you, Christine, for sharing Patrick's journey. You're an amazing sibling. And thank you so much for the support of the Elizabeth Nash Foundation and the CF community too. Okay. Okay, so we're going to hear from Elyse. Well, we're going to hear in her voice, Elyse Elconin Goldberg. Elyse is an adult with CF who received a double lung transplant 10 years ago. She had a career in marketing communications before starting a family. She has 2 adult children, is now a grandmother. And until recently, Elyse served on CFRI's board of directors and currently is a member of CFRI's CF Adult Advisory Committee and the CFRI Retreat Committee. And she also serves as the chair of the Lung and Heart-Lung Transplant Patient and Family Advisory Council at Stanford. And Elyse, well, Siri is going to share Elyse's experience, and she'll tell you why, facing multiple cancer diagnoses since transplant.
Hi, everybody. I'm clearly not Elyse, and I do want to say she's given me full permission to at least bring her voice to you and her story. And she also gave me permission to say that she was all set to come today. And as you'll hear, she is just so religious about remaining covered at all times to protect from skin cancer, and was preparing to come speak to all of you virtually and found a tick in her scalp. And she is extremely immunocompromised, so she is off taking care of that now. So if she is able to log in later, we hope she can join us, but she did send me her statement and asked that I share it with all of you. So thank you. I'll just read straight from her statement. CF and post-transplant patients are at an increased risk for epithelial cell cancers, which includes skin cancer. CF patients have a 5 to 10 time increased risk, and post-transplant patients are at a 100-fold higher risk for developing squamous cell skin cancers and 6 times higher risk for basal cell carcinomas. The skin cancer risk for post-transplant patients increases with each subsequent year post-transplant. Both CF and transplant patients take medications that make us more sensitive to the sun, which can lead to sunburn and then skin cancer. Post-transplant patients' immunosuppressant medications are especially known for increasing the risk of skin cancer. My skin cancer journey started 28 years ago when I was diagnosed with melanoma. Gratefully, it was caught early. Thank you, and thanks to a fellow CFRI community member who identified it, ironically, in a CFRI meeting. I recall my shock upon being diagnosed with melanoma, as very little information was available at that time about the increased risk of cancers in the CF population. This melanoma was excised, and I've not had any recurrence. The good news about being diagnosed so many years ago with skin cancer was that I became very vigilant with wearing 50+ sunscreen, big hats, sunglasses, and always wearing SPF protective clothing when I'm outdoors. My husband and I are avid hikers and have a tremendous love for the outdoors. We try to avoid the peak UV index between the hours of 10 a.m. and 4 p.m. That said, we are often out much of the day, and I take all the precautions I can with SPF clothing, my full brim hats, and sunglasses. In 2013, I had a double lung transplant. 7 years later, skin cancer reared its ugly head again. I have had 6 skin cancers, unfortunately 3 on my head and face. Up until this past April, the squamous cell cancers were excised and no further treatment was needed. My more recent squamous cell cancer was located on my left lower eyelid. Last August, this area in question was thought to be a sty. I had serious concern that this was not a sty. After several months of applying hot compresses, and there was no change in that sty, I encouraged the eyelid specialist to take a biopsy. The initial biopsy was taken from the inside of my lower eyelid. With huge relief, the biopsy came back benign. While the eyelid specialist suggested I return in 3 to 6 months, my response was, no way. I came back in a month. In that time, I could see significant changes in the appearance of area in question. Another biopsy was taken on top of the bottom eyelid. Unfortunately, the pathology of this biopsy was, quote, aggressive squamous cell carcinoma skin cancer. I had 4 rounds of Mohs surgery, followed by 2 plastic reconstruction surgeries. What I had not anticipated was being referred for follow-up radiation therapy. I just finished 6 weeks of radiation therapy last Thursday. I am in the healing and recovery stage of radiation and will be monitored very closely by the Mohs surgeon, eyelid plastic surgeon, and radiation oncologist for a very long time. In my opinion, you can never have enough eyes on, quote unquote, checking the area for recurrence or a metastasis to another area of my body. I have a few slides to share to provide some additional information about skin cancer, and we are happy to share these slides with you. And her final best practices to avoid skin cancer, as she shared, when outdoors or exercising, always wear SPF or UPF protective clothing or items with a tight weave. Always use sunscreen. Best option is one with the zinc oxide as the only ingredient. Try to avoid the outdoors between 10 a.m. and 4 p.m. and stay in the shade whenever possible. Always wear full coverage SPF hat and good quality sunglasses. And post-transplant individuals, discuss with your transplant team whether alternative immunosuppression medications can be used that have a lower skin cancer risk. So on behalf of Elyse, thank you for listening.
Okay, all right. I hope we all got those great tips from Elyse to mitigate our risk of skin cancer. Our final panelist today is Thomas Horal. Thomas was diagnosed with cystic fibrosis at the age of 5. He dedicates much of his time volunteering to support domestic violence survivors and the elderly. Last year, at the age of 31, Thomas received a colon cancer diagnosis. Currently in remission, Thomas continues his journey of commitment and dedication to community while actively participating in CFRI advocacy events. Welcome, Thomas.
Thank you so much. Hello, everyone. So my name is Thomas Horal. Again, I was diagnosed at age 5 with cystic fibrosis, and at age 30 was diagnosed with stage 4 colon cancer. My story with colon cancer begins in August of last year. It was around the time of the CFRI summer retreat. I was starting to have stomach pains and bloating and discomfort. I dismissed it thinking it was just your typical CF stomach issues. I wasn't sure if I wasn't taking enough enzymes, or maybe they weren't working anymore, or maybe I was just eating something bad that I shouldn't be eating. So a week after retreat, or during retreat, we had learned about colon cancer during a virtual discussion. And a week after retreat, I was having a lot of stomach pain. I went to use the restroom, and instead of your typical bodily waste, it was just pure blood. So I then called my sister right away, had her take me to the emergency room. There, they decided to do blood work, all their questions, and they almost sent me home. they told me I probably just had hemorrhoids and to monitor it, and if I have more blood to come back in. But because I have CF and had just learned about colon cancer, my sister and I brought that up to the doctors, and they actually listened. And the next day decided to go ahead and order a colonoscopy. So I was, in the emergency room for a couple days. Finally, they gave me the go lightly, 2-liter gallon. I forget exactly how much it is, but it's a lot to do the bowel prep. Went in, they put me under to do the colonoscopy. So it was an amazing, amazing sleep. They did that. And then I was put up to a hospital room. Actually, I think I have a photo. Yes, that's me in the hospital. Right one is just me, I think, at the emergency room. And then the left one will be coming up soon when I discuss. And yeah, so it was up to the room. And then within a few, I think it was like about 3 days, 2 doctors came in and told me that I had colon cancer and then left. So didn't really have a lot of information until, a few days later, I, called my family, told them over the phone, they came by, and then, so still waited a few more days because I didn't have the full pathology in, because I didn't know what stage I had. Eventually, we met with an oncologist, and they told me at stage 4 that it had spread to my liver. From there, so because I had a port, we ended up actually starting my chemo within the week of me finding out I had cancer. And that was that was in October. I started chemo. I'm sorry, September, I started chemo. October 12th, I had a blockage. So I went back to the emergency room where they decided to do surgery. They had removed part of the colon with the cancer that was affected. They also, because of that, had to do an alostomy to let me heal. So I had that for a long time. And then in November, I had to do, was my birthday. So I ended up having to do chemo on my birthday. So that was, not the funnest thing. I've had hospital stays on my birthday, but having to do chemo, that was its own thing. But I made it through. I still dressed fabulously for the hospital. And then come January 18th was supposed to be my 8th cycle of chemo. But then my blood platelet count was really low, so they decided not to do that. From there, I was just in recovery for my surgery. So come 2 months later, on February 28th, I went back to the hospital to remove part of my liver where the other cancer was, and also to reverse my alostomy. And then from there, I'm just been recovering from all that. March 28th, I had another appointment and scans with my doctor where she gave me the news that I was in remission. Thank you, thank you. And so now about every 3 months, I go in for scans and also blood work to make sure everything is looking good. And if anything does pop up, we will tackle that right away. And then I think so the left photo was me when I had my blockage. And then some of my, just because I was going through chemo doesn't mean I'm not gonna just wear sweats. So so the left one was during Thanksgiving. And then my very fun Christmas onesie that I was wearing. And then also rocking on the right photo, I am wearing my alostomy and my chemo bag at the same time. So I was just fully covered on my my stomach area. And then this was me getting my scans for the first time after, my first scans after being, after all my surgeries. So yeah, that is my cancer journey. Thank you.
So I'm so sorry, we're out of time. Thank you to all the panelists for sharing your journeys and personal stories. By doing so, you're helping others to seek screening to prevent a cancer diagnosis and to encourage others to receive a needed diagnosis so that treatment can begin. Awareness, detection, and early intervention are key. And it's been my honor to moderate this panel. And thank you so much to all of you who've attended and participated.